Hello, my name is Hayam Hiba, ID 62207. Today we're having a presentation about transcranial magnetic stimulation for the course of electromagnetics. First, we're going to start with an introduction and some historical background. We start with the question of what is TMS. TMS is a non-invasive form of brain stimulation that uses a changing magnetic field to induce an electric current at a specific area of the brain through electromagnetic induction. So essentially, it's electrical stimulation with the delivery of an electrical field to the brain mediated by a magnetic field. We start with the history of the TMS, or in better words, the history of the physics theories that helped us develop the TMS as a device. We have Luigi Galvani, who discovered the electrical nature of the nervous system and showed that electrical currents can stimulate muscle contractions. We also have Carl Fritsch and Walter Nernst, who developed a method to measure the electrical potential difference between two electrodes, which is now known as electroencephalogram, or for abbreviation EEG. So a brief note about EEG is that EEG is a non-invasive also test that records electrical patterns in your brain. The test is to identify problems related to electrical activity in the brain, for example, for cases of epilepsy, a sleep disorder, deep depth of anesthesia, coma, and even deaf brain. And during an EEG, the electrodes are placed on the scalp of the subject to detect electrical signals produced by the brain, and these signals are then graphed and examined by a healthcare provider. In the shown picture, the TMS device is shown during usage on a patient. In the 1980s, the TMS has become a leading option for mental health treatment. It was a treatment for problems of depression and even other neurological and mental health conditions. We start with the core component of the TMS, which is the electromagnet. We said before that we're using an electrical field induced by a magnetic field. So the electromagnet is a main component in the TMS because it's the source of the magnetic field that derives the electrical current in the brain. And without it, there is no TMS. Also, the electromagnet determines the spatial resolution and depth of penetration of the TMS, as well as its safety and compatibility with other devices. But why are we using specifically an electromagnet? It's worth mentioning that the electromagnet wasn't invented for the sole purpose of the TMS, but it existed way before based on physical principles that had been widely used for decades in other fields such as engineering, physics, medicine. But we use electromagnet instead of other methods such as radio frequency stimulation or direct current stimulation because it's more efficient, it's reliable than other methods that require more power and have lower spatial resolution. Also, it has less risk of tissue damaging and heating than other methods, as it does not involve high frequency currents or direct contact with electrodes. And this is very important for the safety of the people who are using using the TMS as subject and as patients. In this part, we'll talk about the mechanism of the TMS and its tolerability with the human body. The first question is why the TMS is tolerable. Well, this is due to the skull's low electrical conductivity, resulting in a very strong electrical field in the skull relative to the brain. In the picture, it's shown the different components of the TMS. The two main components are the pulse generator, A, and the electromagnetic coil, B. Other parts are a neuronavigation system, C. It helps the health provider read the results of the TMS and see them on the screen. We have optical trackers both on the coil, D, and on the subject's head, E. How do all these different components interact together for the TMS to work? Well, the pulse generator controls the temporal waveform and amplitude of the TMS pulse, while the coil shape and placement determine the spatial distribution of the electrical field induced in the brain. To describe better what is happening in this picture, um, to see how it affects the brain, well, the frequency and the duration of TMS can be divided based on the frequency and duration and intensity or amplitude of the stimulation. A single or paired pulse TMS causes neurons to, in the neocortex, under the site of stimulation, the area where the stimulation is happening, to depolarize and discharge an action potential. If used in the primary motor cortex, and this is a region in the brain, it produces muscle activity referred to as motor evoked potential, which can be recorded in electromyography. So, in everyday terms, we can say that this electrical current induced in the brain can help produce some motor reaction or some movement in the human body. If used in the occipital cortex, and this is the part of the brain responsible for vision, phosphenes, these are flashes of light, they might be perceived by the subject. In most other areas of the cortex, there is no conscious effect, but behavior may be altered. For example, the subject can have slower reaction time on a cognitive task, or changes in brain activity may be detected using diagnostic equipment. So, this is how the process is conducted, what actually is happening in the picture, and what are the effects of what is happening afterwards. Going back to the physics part and the electromagnetics part, the pulse generator is an important component of the TMS. Um, its principal functionality is to generate a magnetic pulse by rapidly transferring energy from a capacitor in the pulse generator to the coil. Energy efficiency is very important, of course, especially for repetitive TMS devices, as the average power circulated through the coil is the product of the pulse energy and the repetition frequency. And energy efficiency will show up in upcoming slides when we talk about the heating and we talk about the safety. We have the coil. The coil is where the actual induction happens, and the simplest type of coil um, is the round coil, but the figure 8 shown in the picture is the one most commonly used due to its focality. So the coil here induces a magnetic field proportional to the total current flowing through the coil's cross section, and we have an equation that describes the direct proportionality between the electrical field and the change in the magnetic field, also direct proportionality with the number of coils and the change in the current flowing through these coils. Also, here we have different shapes of coils. They're all used for the same purpose, but with different shapes and different number of turns. Here we got to the part of the heating. So we know that, of course, we mentioned before that there is less heat dissipation in the TMS using the electromagnet in comparison to other methods, but we didn't say it's non-existent. So of course there will be heat that radiates due to the energy loss due to the pulse repetition frequency. So there must be some cooling mechanism in the TMS for the safety of the patients and also for the safety of the components of the TMS. Also, the high currents in TMS coils result in substantial internal coil forces, producing mechanical deformation and oscillation of the coil surface that generate an audible clicking sound and tapping on the subject's scalp, and this can cause an inconvenience to the people that the examination is conducted upon. Finally, for this part, we get to the device safety. TMS devices, as we mentioned before, must be designed to operate safely, considering many factors such as insulation, mechanical integrity, um, safe operating temperature, mitigation of the coil clicking sound, protection from erroneous delivery of high amplitude or frequency pulse strains that could induce a seizure for the patients. Also, the TMS, due to its inductive nature, can have an effect on implants with wiring inside the brain, because as we said before, the procedure is performed by connecting electric pulse generator and trying to induct an electrical field by a change in the magnetic field. So all these factors can affect any implants inside the brain and can cause damage to these implants and consequently cause damage to the patient.
My name is Adel Yasser. My ID is 6848, and we will be continuing our presentation on the transcranial magnetic stimulation TMS, and we will be continuing from the part of magnetic field properties. To start discussing the magnetic field and its physics, we have to first concentrate that we want to make electrically excitable cells, such as the neurons and muscles, be affected by an electrical field and be affected by a time varying electromagnetic field. So we want the magnetic field in theory, but we will apply it by using electromagnetic fields. And we do so by applying this time varying field on certain areas for neurons in the brain to apply certain effects. Such phenomena is usually regarded by Maxwell's equations like Faraday's law of induction, which concerns the magnetic flux, which equals to the number of turns multiplied by the instantaneous change in flux density, and Ampere's circuital law. Here in our setup, there will be two main components for the total magnetic field that is applied on the brain or the neurons, which we will be classifying as E primary and E secondary, and both of them follow Faraday's law of induction. The first E, which is E primary on the left, is concerned by the change in B field, which is the magnetic flux density. And the secondary electromagnetic force is concerned from the accumulation at tissue interfaces in the head due to the primary E field. So we basically have the primary magnetic field, which is coming from the change in flux density, which is E primary. And then from that, from its effects on the tissue of the brain, it also causes some secondary electromagnetic force on itself, which is also implied from the figure in E secondary, which you can see the direction of the arrows. And when we do the vector addition, we will result in the vector direction as shown in the figure on the right, which is the total electromagnetic field opposed. So from our current setup, we can deduce from our rules that we will have three things that we could obtain, which are the primary electromagnetic field, and we have some boundary conditions for the electromagnetic field at the tissue surface from the surface and the electromagnetic field within the tissue itself. So these are the three things that we would output from these rules and calculations. The head model itself is modeled using an MRI machine, where its MRI dataset will model major types of tissues present in the head and will give them conductivity from these findings. So for example, on the table on the right, we have things like white matter and gray matter and their conductivity values 0.1 to 0.4 for white matter. For the bones, in like compact bone, for the spongy bone, for the scalp itself from the outside, and as well as the cerebrospinal fluid. We must also state that there are several limitations in the electromagnetic field that is outputted by the TMS machine. We will go through them in the next slide. And so we have four main limitations of the induced electrical field from the TMS machine. The first one is going to be that the maximum magnitude of the electrical field from the TMS machine will always be at peak value at the surface of the tissue. And at any ports deeper in the tissue, it will not have that peak value, which is an inconsistency that has to be accounted for. The second limitation is that the electrical field from the machine itself decays very rapidly as the distance between the machine and the coil head and the head of the patient is increased, and it decreases very rapidly, so it has to be taken into consideration. The third limitation is that the stimulated head itself and the head of the patient will always have an optimal coil size to have its optimal effect. And so the optimal coil size having depending on the side of the simulated head, and since we as humans don't always have the same sizes of heads and the same distances from the machine, so it will always have this inconsistency in the diagnostic and the therapeutic effects. The fourth fundamental limitation is that the waveform itself from the TMSE field is going to have both positive and negative phases, but the area under the curve for the positive and negative phases must be equal in total. It must be equal. For example, here we have as a demonstration the TMS field effect on three heads, on a mouse, on a monkey, and on a human. And from the figure, we could easily deduce that the efficiency itself is decreased when the size of the head is decreased. So the size of the head of the mouse has very low efficiency when using the TMS machine. And the opposite is true for the human head. And on to the next section where we will discuss the biophysics and responses to stimulation. So first, we have to make it clear that it is not the magnetic stimulation in itself that's important. It is the electrical stimulation that is coming as an effect from the magnetic field. We want to have this contactless and non-invasive procedure to apply the effects of electrical stimulation. So we will have few notable differences in the E fields relevant to the neural activation. And so the E field that we are inducing is mainly important as the electrical currents that are into the cell membranes of the neurons are having the effect on the brain that we want. But we have to take into consideration on the level of the membrane of the cell at this small scale that we can no longer assume approximations and omit capacitive effects. So the equations become very complex at this small level. And so to measure the effect from the TMS, we're going to be looking at effects psychologically, behaviorally, and cognitively, as well as the emotional response, which is the doctor will be assessing. And what could be used are some tasks like tasks of memory, task performance, and the mood swings. There can also be electrophysical recording of the neural or muscle responses, and some imaging could be used. And now we will be discussing some clinical applications where this machine could be used diagnostically and therapeutically, and we will go through each one of them in detail. For the diagnostic application, the TMS itself can check how signals are transmitted inside of the brain, as it applies this magnetic pulse at specific areas of the brain and observing the muscle response. And this could be identified very visibly, like when diagnosing diseases like multiple sclerosis, which is very visible on the diagram on the right, where the myelin sheath itself becomes corroded. And this operation could also help in having to map brain functions. As for therapeutic applications, we have RTMS or repetitive TMS, which is approved by the FDA, which is most famous as a therapy session known for the treatment of depression in multiple frequencies. It's also being tested for use on other diseases like pain, schizophrenia, disorders, and epilepsy. And here we have a small therapeutic example and application where a patient could be using the figure 8 coil for a session that is 5 days per week and lasts for 4 to 6 weeks. And we can see how much doses that the patient endures, which is about 75 or 37.5 minutes or 3,000 pulses per day, which is very rough but very useful. And so we conclude that the TMS is a wonderful machine that is used non-invasively to treat and diagnose mental illnesses and problems with the brain, which is amazing because it is non-invasive. And here we give credit to the references that we have used to make this presentation possible. Thank you very much for watching. So we conclude